Welcome to the Medicaid Program Integrity, Fraud, Abuse, and Misconduct presentation. My name is Terry Ashburn, and I am an analyst with the Medicaid Program Integrity Unit. In today's presentation, we will review the following topics: definition and examples of fraud, abuse, and misconduct, examples of fraud, abuse, and misconduct, overpayments, provider-compliant billing resources, overview of the Medicaid Program Integrity Unit, overview of the Medicaid Fraud Control Unit, and methods to prevent fraud, abuse, and misconduct. Healthcare fraud can cost Idaho taxpayers millions of dollars. Non-compliant claims not only cost taxpayers, but it may also endanger the health and welfare of Medicaid participants. Medicaid Program Integrity strives to combat fraud, abuse, and misconduct efforts by conducting investigations and audits. Medicaid providers who submit claims for reimbursement are required to provide and bill services in accordance with all applicable provisions of Idaho statute, administrative code, and federal regulations under the Medical Assistance Program, Medicaid. Idaho Administrative Code 16.05.07.100.01 addresses investigation and audits. The department will investigate and identify potential instances of fraud, abuse, or misconduct by any person related to or involved in a public assistance programs administered by the department. Methods may include conducting audits and interviews, review of computerized reports, review of medical records, referrals to or from other agencies, healthcare providers, or persons. So what is fraud? Fraud is defined as an intentional deception or misrepresentation made by a person with the knowledge that the deception could result in some unauthorized benefit to himself or some other person. What is abuse? Abuse is defined as provider practices that are inconsistent with sound fiscal, business, or medical practices and result in an unnecessary cost to a public assistance program, in reimbursement for services that are not medically necessary or that fail to meet professionally recognized standards for health care, or in physical harm, pain, or mental anguish to a medical assistance recipient. What is misconduct? Misconduct is defined as wrongful, improper, or unlawful conduct related to public assistance rules and programs, including violations of rules, statutes, provider agreements and terms, provider handbooks, and any instructions contained in provider information releases or other program notices. Fraud, abuse, and misconduct examples may include maximizing payments by incorrectly reporting a diagnosis and/or procedure, altering claim forms, medical records, or receipts to obtain higher payment, billing for services that the provider did not perform, upcoding services by submitting claims at a higher level of service than what was rendered, unbundling charges to avoid medically unlikely edits to receive higher payment, billing unnecessary medical services, billing non-covered services, charging in excess for services or supplies, providing services that do not meet professional recognized standards, billing for services not authorized, billing for services not properly documented. The department will recover payment for services not provided or not found by the department to be medically necessary, services not documented to be provided or medically necessary, services not provided under professionally recognized standards of health care, services provided as a result of a prohibited physician referral, services billed that are contrary to department rules or the provider agreement, and failure to provide immediate access to records. The department and Medicaid Program Integrity proactively make efforts to communicate available resources to assist providers with tools to bill services provided to Idaho Medicaid participants that are compliant with rule. Some examples of resources provided are Medicaid provider agreements, which outline compliance, record keeping, accurate billing, and payment. Idaho administrative codes located on the department web portal for reference. Provider handbooks addressing compliant provider billing practices. Monthly Medicaid newsletters addressing non-compliance trends. What providers can do to help avoid fraud, abuse, and misconduct. An effective compliance plan assists providers in identifying weaknesses in internal systems. It also helps to ensure claims submitted are accurate and compliant with rule. Some elements to an effective compliance plan may include conducting internal monitoring and auditing, designating a compliance officer or contact, responding appropriately to detective offenses, conducting appropriate training and education. Compliance plans may help identify payments received that fall under the categories of fraud, abuse, and misconduct. Medicaid program integrity encourages providers to self-report identified overpayments. When a provider reports an overpayment to Medicaid program integrity, in certain cases, civil monetary penalties are not assessed. The Medicaid Program Integrity Unit reviews services billed to Medicaid to ensure providers have been paid appropriately in accordance with Medicaid rules and regulations. The Attorney General's Medicaid Fraud Control Unit investigates and prosecutes Medicaid fraud by healthcare providers and the abuse, neglect, or financial exploitation of participants in any facility that accepts Medicaid funds. Medicaid Program Integrity works closely with the Medicaid Fraud Control Unit and refers credible allegations of fraud to them for further investigation. Things to remember. Having an effective internal compliance plan may avoid potential non-compliant billing to Medicaid, which could result in identified overpayments and/or civil monetary penalties. Utilizing Medicaid resources will assist providers to identify and prevent non-compliant claims. It may also help identify possible criminal and/or unethical conduct. This brings us to the end of our presentation. Thank you for carving out time in your busy schedule to review this information regarding fraud, abuse, and misconduct. If you have any questions, you may contact the Medicaid Program Integrity Unit at 208-334-5754 or by fax at 208-334-2026. You may also email us at prvfraud@dhw.idaho.gov, or you can mail us at Medicaid Program Integrity Unit, P.O. Box 83720, Boise, Idaho 83720-0036. Thank you very much.